you can imagine Americans all around the country, they don't want their tax dollars misused. So we'll start here because there are some pre-authorization programs that are new that I do want to ask you about. But what has been the depth of the fraud that you've uncovered thus far? And what are the efforts that continue today to continue to weed out some of those claims?
Tens of billions of dollars of U.S. taxpayer money is stolen every year. We had a $15 billion bust that was designed to take out a multinational criminal organization, primarily based in Russia. We know that because when the perpetrators were accused, they fled to Russia and the Baltic states. We have major fraud in hospice in California, run by, again, it seems like an Armenian multinational group. We have South Florida dominated with these durable medical equipment companies. There are 20 times more of these companies than McDonald's in South Florida. They seem to be supported by the Cuban government. You're all reading the news now about Minnesota, when the Somalian population of Minnesota seems to be engaged for a number of folks of the fraud around things like extra care you get for autism, problems with housing are often dealt with organizations that are also involved in criminal activity. So we have to clean up the act, and just giving money to programs with the hope they'll do a better job next year is not the solution. We have a whole war room here at CMS. All we do is just track the numbers. When is there an uptick in expense? If care for autism is going up twice in 2 years, like literally doubling in 2 years, there might be a problem because we don't have twice as many autistic kids as we had 2 years ago. So something's got to give, and we're out there with investigators, and we have a pretty aggressive group in the Office of Inspector General looking for these programs and going after perpetrators. So we will clean it up. It will take time, but technology is going to be part of the answer.
Well, I appreciate that. And as a taxpayer, I think many Americans do appreciate that. So let's talk about some of the concerns. Speeding up, avoiding a misuse of funds, that's a major goal of the administration, as you know. But there are these pilot programs at the same time with AI rolling out in some of them. But you also have traditional Medicare practices that are expected to go through some prior authorization as well. That hasn't been the case in 60 years. Now, the critique and concern is that treatments will be delayed or denied. So what is your message to patients who do fear these developments are going to complicate some of the care that they need?
So we're rolling out some prior authorization on abused practices. The purpose of these is not to deny care. It's to make sure you get the care you need and deserve, not the care that some unscrupulous doctor wants to use on you because he can talk you into having spine surgery or knee surgery. So the vast majority of procedures, there are probably 15,000 procedures that we put codes on that are commonly used. And we're talking about less than 100 procedures, a very tiny fraction. Where there may be instances of abuse that we want to double check. But our ultimate goal, and we're doing this very successfully now, is to get every single insurance company to agree that prior authorization is a very mediocre approach to taking care of these problems. What we really want to do is create either a gold card system where the good doctors never have to do prior authorization. If your doctor seems to be ethical and do the right thing and consistently on your game, we don't want you to bother with this stuff. We'll just automatically allow you to take care of patients as you desire. However, if you're not one of those doctors, then we do want to double check your work once in a while to make sure patients aren't abused. There are only so many safeguards that are out there that are permissible. This is one that seems to make sense. But again, this is a pilot program. We're experimenting, trying to see better ways of doing it. But more powerfully, we've gotten all the major insurance companies to agree voluntarily to also pare back their prior authorization techniques. We do not want that precious covenant when a doctor and a patient are talking about something really important about the patient's health, to have the long arm of insurance come in there and interfere with that conversation. We want these doctors and patients talk appropriately with each other. We just want to make sure that when there's events happening that we don't think are the norm, that are outside what we would have expected in terms of a frequency of surgery, that we don't look. We should look. Just like we have fraud in people stealing money from Medicare and Medicaid, you once in a while have doctors who are not the top of their med school class, not doing the best job for their patients, and you want us protecting you from those doctors.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.